Hi, good morning, everyone. My name is Sequista Wilson. Today, the topic of my persuasive essay will be enhancing mental health in adolescents. As a mentally ill patient, do you ever contemplate how one would have to live through a pandemic? In your opinion, what would you do if all of your leads to getting the necessary mental health services were closed down one day? Imagine if you were a child who required psychiatric services but could not access them. These are realities that many have been living through the world struggles with COVID-19. Imagine a situation where you have a life-threatening virus that house quarantines you for an unspecified number of days, and you cannot communicate with your mental health centers. This has been the experience of many individuals with severe mental illnesses, especially during this COVID-19 pandemic period. Today, I will focus on the importance of improving the availability of mental health services due to the COVID-19 situation. The COVID-19 pandemic has negatively affected the lives of people with severe mental disorders, which highlights the need for improved mental health services, especially for children. First of all, I will discuss the impacts of the pandemic on patients with severe mental health issues. Secondly, I will address the issues that children experience in order to receive mental health care. Finally, I will outline realistic recommendations that could improve services for mental health illnesses. My first subject that I will set up here and that I will touch on is the impact of COVID-19 on the population suffering from severe mental illnesses. COVID-19 has greatly affected individuals with severe mental health disorders. In their study, McGrundam revealed that the majority of the patients with severe mental illnesses lack knowledge about the outbreak. McGrundam asserts that 30% showed features of relapse of symptoms during this lockdown period. Another observation was that patients with lower SES and those who have low education attainment had limited knowledge of COVID-19, making them more vulnerable and prone to flare-ups. According to McGrundam, they found out that patients with severe mental illness revealed that television was their primary source of information as gadgets and the internet became scarce. Let us now turn our attention to the issue of children dealing with the difficulty of getting help for mental health issues. Whirling, a systemic review and mental analysis published in Epidemiology and Psychiatric Sciences last year, pointed out that children also experience many barriers to accessing mental health services, which the pandemic has further compounded. They affirmed that patients with lower SES and low educational attainment had poor knowledge about COVID-19, which can be attributed to limited internet, media, health information source, and portal access, less access to health care, and high costs. The current research also found that there is a high level of pandemic-related psychological distress, which is likely to have caused an increased incidence of mental health disorders. Whirling asserts that psychological stress triggered by the pandemic and the novel locking up raised the chances of creating more mental health complications and aspects such as isolation from friends, family, loss of freedom, uncertainty of health status, and lack of access to food, essential commodities, boredom, and inadequate information. Based on the mentioned challenges, it is crucial to draw strategies for enhancing mental health services. My next topic is the possible interventions to enhance the quality of mental health care. The following measures should be adopted since stigmatized information is complex to come by. Media that is readily available to populations vulnerable to this stigmatization, including the severely mentally ill, should be used. McGrundam, since most stigmatized information is currently unavailable or inaccessible to the general population, use the media that is within reach of vulnerable person should suffice. Schools cannot be regarded as institutions that do not have severe responsibilities regarding the mental health of their students. According to Whirling, we find that school-based interventions with a focus on a general population affected the steps before care access to a greater extent at the initial stage and included knowledge and attitudes. In conclusion, I would say that COVID-19 has exposed severe deficiencies in the accessibility of mental health care services to people with mental health disorders and children. Therefore, one cannot overemphasize the need to provide education on the problem and the signs as a duty that ought to be driven in keenness. The pandemic has worsened the position of people with schizophrenia and other mental severe orders, which has also while exposed the problems to children with mental disorders face in accessing appropriate treatment. This has made the issue of considerable importance that needs to be addressed. It is possible to prevent such situations where a person in need of treatment for mental health illnesses cannot receive proper care. Because when no one knows about the problem, there are no available mental health services.